In this video, we will discuss about the liposomal nanoplatform that can alleviate the bone cancer metastasis at the same time pain associated with it. So the idea is that they took the oxidation oxidation responsive derivative and mixed them with this plasmid DNA, which has the gene of interest such as sting agonist and other things to trigger pyroptosis, and then form a nanocomplex, and this nanocomplex later integrated with the liposome to form liposomal nanoplatform, and this liposomal nanoplatform is formed. So and then once it integrates or interacts with the tumor cells because of the membrane fusion, which is the property of the liposomes to internalize itself into the tumor cells, and thereafter it can on one way it can trigger this sting agonist that will activate the immune system of the patients against the tumor cells. At the same time, it will release the cytokines or lytic cytokines that can trigger the pyroptosis of the same tumor cells. Pyroptosis is mainly the programmed cell death through inflammations, and here it is shown that it can be triggered by this granzyme release, which is one of the lytic granules, and also the perforin. It can triggers the death of the tumor cells, and thereafter the other things that there is the GSD MB. So they use example shown here for this GSD MB. So this GSD MB will also cause also affect this VGCCs, and in a way that will increase the calcium influx. And because of that, what will happen once the calcium influx is increased, then it will prevent the crosstalk of these tumor cells with the nerve. It will prevent these tumors, this like this conditions will be occur. The tumors and the nerve interactions will be less, and there will be less crosstalk between them. And overall, what it will cause, it will reduce the metastasis. It will reduce the metastasis of the this bone cancer. At the same time, the pain associated with it is also been reduced, has been found in the mouse studies. And so without this, so in this case the main problem with the bone cancers is that its metastasis and the pain associated with it is causing a troublesome or making it difficult for the patients who are affected with the bone cancer to live a stable life. So by developing these tools, that is liposomal nanoplatform, they can enhance the lifestyle of the patients who are affected with the bone cancer through these lipo nanoparticles. We will discuss in our subsequent videos how they come up or how they check their hypothesis about the effect of these liposomal nanoparticles on the bone cancer. And we will also discuss how they developed or optimized their liposomal nanoplatform, which contains this oxidation-responsive derivative and the plasmid DNA. At the same time, it will also have some polymer compositions that will help in this liposomal nano platform formations, or this LipoSC, liposomal nano complex formations. And the cytokines, some of the cytokines that are released or caused by this GSD-MB is this DAMP cytokines. DAMP is and this DAMP and the sting agonist will cause the release of IFN1, and both of them can interact with these dendritic cells, thereby triggering the activations of the dendritic cells against the tumors, and they can also help dendritic cells later helps in the uh, innate immune response by generating the T cells, by providing information about the antigens to the T cells to generate immune response that is targeted to the tumors that are present within the patient. So this is how it might work, and we will discuss in our subsequent videos what are the results that they have shown and how they validate their liposomal nanoplatforms anti-tumor liposomal nanoplatforms anti-tumor efficacies. That's all for this video. If you need to understand more about these experiments in detail, you can go through the reference that has been provided in the description. Thank you for your time.